Erectile dysfunction had traditionally been a difficult topic for both patients and doctors alike to discuss. It was difficult for doctors because effective remedies were not readily available. Viagra changed all of that. Viagra, Cialis, and Levitra are the 3 pills available now, FDA approved, for the treatment of erectile dysfunction. These pills all work by a similar mechanism. These pills allow the flow of blood into the penis to increase because it prevents an enzyme within the penis from stopping that flow. As long as there is flow of blood into the penis, these pills can increase that flow of blood. These pills have slight variations in how quickly they work and the timing of how they should be taken. Viagra should be taken at least 1 hour prior to intercourse, and it is typically active in the system for about 5 or 6 hours. Now, it may linger longer in some men, but this is the typical duration of action. It's best to take Viagra on an empty or light stomach, and it is not as effective if consumed with moderate to large amounts of alcohol. The same is true for the other brands as well. Cialis takes about 2 to 3 hours at least to get into the system, but once it's in the system, can last up to 36 hours. What that means is that the patient has up to 36 hours in which to choose to engage in sexual activity. The erection will still go down after the patient reaches climax, but there is a 36-hour window of opportunity. It does not matter if it is taken with food or without food, but what does matter is that a sufficient amount of time is allowed for it to work. Levitra has a similar duration of action to Viagra, that is, about 5 to 6 hours. Like Viagra, it should be taken about an hour prior to sexual activity or more. But taking Levitra or Viagra less than an hour prior to sexual activity may result in it being ineffective because not enough time was allowed for it to get into the system. Unlike Viagra, Levitra can be taken with or without food. Which one is best? Well, they're all very similar, and in some patients, some formulas work better than others. In some patients, Viagra produces a stronger erection, while in others it's Cialis or Levitra. In some patients, Viagra causes side effects, while in others it's Cialis or Levitra. The side effects associated with these medications are very common, but they are not dangerous. The typical side effects may include any one or more of the following: headache, indigestion, facial flushing. In the case of Viagra, there's a higher incidence of seeing a blue hue around objects that you are looking at. In the case of Cialis, there is a greater incidence of backache. In all cases, these side effects are temporary. The only severe risk of any of these medications is taking them in conjunction with nitroglycerin-containing medications. That may be the small nitroglycerin pill a person places under their tongue, or other prescription medications or patches or ointments that contain nitroglycerin. If a person is taking any medications that contain nitroglycerin, or they have a propensity to need nitroglycerin, they should not use this class of medication to treat their erectile dysfunction.